I can start. So welcome everyone. This is our second book read event with guest speaker Jackie Valenzuela. Welcome everyone.
Hey everyone, thank you for joining for today's book read event. So here on the side, we'll just go over about what PHSA is. So PHSA, with our mission statement, aims to provide all public health students with the opportunity to obtain career-based opportunities in order to grow personally and professionally. We advocate for the needs of all students within the Department of Public Health in regards to their education and welfare. We create an outlet for networking and volunteer opportunities. Here we have our 2022 to 2023 Executive Board, also known as our E-Board. Here we have Joed as our president, we have Brenda, our vice president, we have Daisy, our director of internal affairs. I'm Rochelle, I'm the director of finance. We have Charlie, our director of media and marketing, and we also have Morgan, our graduate student liaison. We also want to introduce our co-chairs for this spring. First off, we have Naomi. We also have Walter Schudis. Next, we have Pamela, Marco, and lastly, we have Nestor. So our co-chairs have been a great help to our e-board, especially planning our events and our future events that we still have for this upcoming semester. So yay, co-chairs.
And then with the PHSA advisors, we have Dr. Kimberly Kissler or Dr. KP, and we have Athena, or our amazing advisors. And we have Professor Gregory Stevens. He is a health policy researcher, writer, teacher, and advocate. He's also a professor at public health at the California State University of Los Angeles.
Great. Okay, Marco, thank you. I think you're handing it off to me here. I appreciate that. Welcome, everybody. I'm thrilled to see a good number of folks here again. This is our second book read event in support of the read of Lifelines by Dr. Leana Wen. I think folks will remember that we had our first event last month featuring Dr. Chris Chanya-Sulkit. She was the head of the president of the American Public Health Association. And if you weren't able to make it to that event, we have a recording that's now up and available on our department's YouTube page. So at some point during this event, I'll provide the link for folks so you can go back and review that. So we have our third event coming up in April. This is the event featuring the author herself, Dr. Leana Wen. That's on April 20th. From 3 to 4:30 p.m. So without any more waiting, let's jump in. We're very lucky to have with us today Jackie Valenzuela. She has a tremendous bio, but the first thing to know about her is that she's an LA local. She is a native here. And we have a long relationship with Jackie in this department, and we're very grateful for the time that she's taking out of her day to be with us. I also wanted to say a quick thank you to PHSA for putting together all the materials and helping coordinate this event, and also to Dr. Kissler for helping arrange this meeting with Jackie Valenzuela, excuse me. So Jackie is an established public health leader, and she's a skilled communicator with nearly 2 decades of health-related government experience here in Los Angeles. She currently serves as the chief advisor to LA County Health Officer, Dr. Mantu Davis. But before that, she served as the senior advisor to Dr. Barbara Ferrer, who's the director of our LA County Department of Public Health. So in those roles, Jackie's worked with multi-sector partners to build trusting relationships and implement programs that bolster collaboration, equity, and investment with community partners across the county. For more than a decade, Jackie served as the Director of Health Education Administration, a program within the Department of Public Health. She's also done some teaching with students in public health at Charles Drew University, Cal State Long Beach, and the best of them all, Cal State LA. So with that, I'm going to switch over screens here. Hopefully, if we could stop sharing, Brenda, and we'll bring up Jackie. So hang tight. I'll try to pin the two of us. But first, I have to find you, Jackie. Hang tight. There we are. Okay, there's you, and I will pin myself next to you. I think we'll do that. Welcome, Jackie. Thank you so much for being here.
Oh, thanks so much for having me. And Dr. KP, I love it. Thanks so much also for making this happen.
So everybody knows I am Jackie's biggest fan, and I am so glad she's here, and I'm so happy you get to learn from her and enjoy all the wonder and grace that is Jackie.
Well, we're going to do this again as a conversation between the two of us. You know, we're having this conversation about public health leadership because it ties in with the major theme of the Lifelines book, which is just sort of the process and the pathway by which people come to leadership, and then some of the challenges in that position. You know, maybe, Jackie, if you could start our conversation together, just with you telling us a little bit about your current position and what you do, and then we'll get into some of the nitty gritty. I just want to remind folks too that we'll do a conversation for about 40 minutes, and then we'll switch over to question and answer period within. We'll open it up to anybody. So have your questions ready to go, and then I'll give everybody an alert maybe 5 minutes or so before we switch over. So Jackie, tell us about what you do within the LA County Department of Public Health.
Sure. So as you mentioned, I'm the Chief Advisor to the County Health Officer. You might know him best by, the health officer orders that are issued or have been issued throughout the pandemic. He's the one that actually signs off on those health officer orders. So a lot of my time is actually spent in helping to craft those health officer orders. And that's, again, during the pandemic, but my day-to-day really involves a flurry of things, everything from speech writing to serving as a Spanish media spokesperson. I also do a lot of convening of stakeholders, primarily around issues of equity. So I work closely with faith leaders and community-based partners. There's also a lot of work that's done with our equity strategies, as well as policy recommendations, working closely with our board offices, just so many different things, making sure that we're talking to one another within the department. I mean, I think folks don't fully understand that we have several areas within the Department of Public Health. I mean, there's around 50 or so different programs. They all focus on something different. It could be, everything from tuberculosis to more of a regionally based office that focuses on the needs of a geographic area within LA County. So making sure then that we're working in synergy and, making sure that we're meeting the needs of our partners as well as of LA County residents. And with that also comes a lot of strategic planning. I'm also responsible for several strategic planning efforts throughout the department, specifically with our senior leaders throughout DPH.
I'm just curious, you sort of threw a lot of high level things there, like strategic planning and all that. Like what does a typical day look like for you? Are you on the phone? Are you on the computer? Are you meeting with community partners? Are you meeting with Muntu Davis? Tell us what your day looks like.
Yeah, all of those things. I think that's part of what I like about my job. I don't really like focusing on just one thing, but during one day I could focus on, as I mentioned, I could focus on COVID. I could focus on sexually transmitted infections. I could be working with health plans. I could be working with our regional health officers. I could be, there's so really a lot of it is, playing nice with others in the sandbox, right? And acknowledging that The things that most impact health aren't really health related sometimes. When we're talking about education, for example, or if we're talking about jobs that pay a livable wage, those things aren't things that public health oversees, right? Those are things that require working in partnership. And so like most of my work is not done alone. So it could be over the phone, it could be, we're slowly moving to more in-person meetings. And I also do a lot of writing. I do a lot of behind the scenes writing that then helps people as they're the ones that provide testimony at, Congress, for example. So I do a lot of thinking with Dr. Davis or with Dr. Ferrer about what are we trying to encapsulate as far as policy recommendations go, or things that are really gonna help us close the gaps in health outcomes. Some, again, that are not related to health whatsoever, but that will require us winning over the hearts and minds, honestly, of partners that do have a stake in this work. So again, some of it is, working closely with others. A lot of it is also spent writing and then having others deliver the messages that I'm helping to put together.
It sounds, yeah, you're sort of you're doing it all, it sounds like to me, and that's really exciting because that's stuff I think our students would be really interested in doing too. Some of this being very high level thinking and planning and strategizing, and some of it being sort of like behind the scenes work where a lot of our students would feel more comfortable, not necessarily being out on the front stage, but playing kind of a supporting role. And that's really interesting. You started as a health educator.
Yeah.
In the county, and I hope we'll sort of pull out that story here. I think in our meeting we talked a little bit. We planned to get a little bit for today. One of the things you were telling me about was the role of mentorship in helping sort of bring you along to your current position. I think you expressed to me that the mentors were able to identify in you something like some leadership potential that you didn't necessarily immediately think of yourself for. I wonder if you could tell us a little bit of that story, because I think a lot of students would relate to that idea that they may not feel ready to step into a leadership role. So tell us about that mentorship and that process.
Of course. Well, I heard recently this concept of if you can see it, you can be it. Right. And so what I saw around me were a lot of really wonderful teachers, and they're the ones that inspired me to go into teaching. Right. I had gotten a degree in English thinking like, I'm going to be a teacher and that's what I'm going to do. And I want to serve and be impactful to my community the way that others have been, to me. But then I worked at a school and I thought, I don't know that this is the right fit. I love teaching, but I don't like the fact that it feels like there's different schools in this one school, and that some kids are just kind of passing the day because they're probably not going to graduate. And then I also have kids that are going to make it to Ivy League schools. And that just felt unfair. And I didn't know what that was. Now I have the words to say, oh, we're looking at the social determinants of health. We're looking at policies and practices that favor some and not others, So anyway, I just knew that it didn't feel right. I just didn't know what to do instead, right? And when I was an undergrad, I was also working at my university's student health center. And that was actually my introduction to public health. And so while I was trying to figure out, like, what am I going to do next? I knew I wanted to get an advanced degree. I just didn't know what in. One of my colleagues there said, well, have you ever considered public health? And I thought, I didn't even know what public health was, right? So that kind of I think that's an example of what happens to many of us in public health. We end up in public health, but not really having focused on that was going to be the career trajectory. Sometimes we end up falling, into it. And that's what happened with me. When I started working for the county, as you mentioned, I was a health educator and I loved my job. And, we had a lot of, challenges in the program at that point. We had a loss in leadership and they were looking for a new director. And I remember literally walking down, to the bathroom and running into a colleague of mine. So I was a health educator. She was a health education assistant. And, so a non-traditional mentor, let's say, because she asked me like, well, did you apply to the director position? And I just kind of laughed it off like, oh no, are you kidding me? I'm not ready for this. I think I need a little more time, or I need a little more, no, I'm not the right fit. So she says to me, Jackie, you have to do this. Don't you know that there's, the impact that you could have? Think about all the Latinos across LA County that are in need of your leadership, And honestly, I mean, she gave me a long spiel about why she thought I should give it a shot, even if I was afraid, or even if I felt underqualified, or whatever the case may be. And she convinced me, she convinced me to give it a shot. And it was really because she saw me in a light that I didn't see myself, and so I actually followed her advice and applied for the job, and, and I got it. And it showed me it's not that I didn't have the skills or the experience. Part of it was just whether or not I could envision it, because I hadn't seen it before, So I think she was not my supervisor. She was not my superior in any way. But what she did have was more experience within the organization. She was also older than I was. So she had just her wisdom, and she was a mother just like me. And so she was able to impart, that knowledge, that experience in a way that was very impactful. And we remained friends, but I think it was one of those things where if it weren't for that conversation, then I wouldn't be where I am today, honestly. Or maybe I would be, but it wouldn't have taken the track that it did, So I think just it's important to remember that this concept of mentorship can come from various angles. You just have to be open to it. And it might not be just from a professional lens. It could also be from a very personal lens where, you could learn if you're open.
And it's a really beautiful story. And just hearing that, this conversation took place in sort of an informal environment. It was just, bumping into this person somewhere, and just the opportunity, the door was open, and having someone, just show you that you could fit through that door, that you would play a great role. I think that's really exciting. Mentorships played a role for, I think, so many of our faculty, and I suspect for many of our students too, and especially for those who've come at public health from sort of a sideways angle. I know I was headed to medical school as my initial thought, and then, but got waylaid once I had some interest in healthcare reform. Someone introduced me to the field of public health. Mm-hmm. And so I think there's a number of stories that sort of follow that path, that we come to public health from different angles. But it's great to have that mentorship and to help you see what's available to you.
Oh yeah, I mean, I feel really honored. I mean, you've probably seen her on TV. She has the recognizable white hair, but working with Barbara Ferrer has been one of the joys of my life, honestly. Not only it started with her, actually her career trajectory, tackling issues of racism as a public health issue way before it became cool to do so, right? So I that was part of what drew me to want to work with her. But then also finding out, because I didn't know, if you look at her, she is not necessarily presenting as a Latina, right? But knowing that part of her background as well was kind of like the cherry on top, in the sense that, as I was mentioning, if I could see it, I could be it. I'm not necessarily angling to become the director of the Department of Public Health, but I think being able to see myself as a leader within the Department of Public Health, I mean, she's definitely helped me in that way. I think having folks that share in your values and in your organizational vision, and also create a space where it feels safe to ask questions and even to fail, honestly, making sure that, you can kind of get that extra push that you need when you need it. And then, just helping you see things that you haven't been able to see for yourself otherwise. I mean, I think those are all things that I've been able to experience working with her, working with Dr. Davis. I mean, I think those are all, I just feel so honored to work with folks that, have these beautiful careers focusing on closing the gaps in health outcomes that just make me feel hopeful for the future of public health and for, honestly, our society.
What was your path from the head of the Department of Education or Health Education Administration up the next path?
Yeah. So, part of what we do in public health is respond to all kinds of emergencies, right? So I really spent a lot of time during my time with Health Education Administration managing teams that would craft messaging, not just traditional health education materials, but messaging for specialized communities during emergency response. So we spent a lot of time working with schools, with faith-based organizations, with other community groups, parents, taking the information that we would share, anything from, radiation after earthquakes, or huge environmental justice concerns like the Exide battery recycling plant, in like our local communities.
Which I think our students study regularly. They hear about that.
Yeah, I mean, I think it's been a joy, but also some of the most difficult work we've had to do, to take some of those messaging and materials and then really think about, well, how are community members going to receive this information and such. So working with this group then and doing that sort of work helped me dip my toe into something that I didn't really anticipate, which was broader marketing and communications. So then there was an opportunity to work with the Department of Health Services to be the head of their marketing and communications for their managed care services division. And so that was completely different. I mean, I think I really took my communications background, my centering of community, sorry for all the noise, everyone. And, decided to pursue that pathway. And that was incredibly helpful because healthcare administration lens on the work is very different than a public health orientation. And looking at things like, how are we going to entice new members to be part of this new line of service? All of those things were very different, very dollar oriented, right? It was more, it included, how do we make sure that we're sustaining the safety net, which is the Department of Health Services. Those are all the public hospitals. But then we had these additional contracts that then would entice new folks to come in that would help us then sustain the safety net. So anyway, I spent some time there doing that sort of work, learning a little bit more about managed care delivery, and then had the opportunity to come back to public health. I actually had a good friend of mine that said, we're interviewing several candidates to come and work. At that time, that position was a special assistant to Dr. Ferrer. And so she asked me, are you interested in interviewing? And I thought, of course. And, I learned a little bit more about her, but it's one of those things where, again, having those really solid relationships with folks, is part of what allowed me to even be invited for an interview. And so then I came in as her special assistant, and over the years, I've been able to grow here in the executive office of the Department of Public Health. So I started off as her special assistant, then I moved on to become her senior advisor. And then I had the opportunity to work as the chief advisor for Dr. Davis. So, it's all been within the executive office, but part of it has been able to demonstrate being able to work at a quick pace with varying folks that all require special attention, right? So whether those are the leaders within our department or our board of supervisors, for example, all of those folks require, a special, attention, honestly, to make sure that we're meeting their needs and that we're being responsive to our residents. So, over time, that's been the trajectory over the last few years.
That's really interesting. So you moved the county departments. You left public health and then went to healthcare services, and then made your way back to public health,
Yeah.
where I'm sure your heart lies.
Yeah. Well,
Um,
you know, that somebody, speaking of mentorship earlier, right? One of the best pieces of advice that I got early on in my career was that LA County could be a wonderful training ground and a wonderful learning opportunity, especially if we're not sold on just staying within one department. You know, I mean, there's lots of, I mean, there's about 50 different departments within Los Angeles County, you know, those, and I just mentioned two, you know, but I think some of the skill sets that we learn, and again, our public health orientation is really in demand, you know, so it really could be helpful, whether it's in arts and culture or mental health, for example. I mean, I think, you know, being able to, you could really use your skills in a variety of places, especially, you know, again, if you're open. Doesn't mean that it wouldn't be challenging. Of course it's challenging. I actually did a stint in nursing school. I did about 1.5 years. And, you know, because I was an English major for my bachelor's degree, I had to do all the sciences, you know, while I was already a working public health professional. I thought, you know, maybe having a clinical degree would be helpful. But it was so difficult to, you know, be on my med-surg rotations and then seeing patients, you know, where they were homeless, you know, and oftentimes they were coming into the hospital because they didn't have food or a place to stay, and they couldn't keep their chronic conditions managed, you know, and all I could do is think about, like, if we had a solution, honestly, a public health solution, then we wouldn't have these patients that I'm trying to help here, you know? And so it felt almost like I was going backwards. And that's why I decided not to complete my nursing degree, because I felt like my heart really is in public health. And so, I mean, I'm going to be transparent about that. It can be challenging to kind of switch things up if needed. But I mean, I think the other piece is, as we get older, as new things happen in our life, right? We have kids, or we decide to have long-term relationships, or whatever the case may be, we continue our education. What we need is a little bit different. So what we're prioritizing also changes, right? So you can decide, like, let me give this a shot and go to this other place because what I need right now is more money. And that's kind of what happened to me. I needed to prioritize making more money, so I had to go, you know? But then as I got older and I made more money, I also realized, well, what I need is job satisfaction, right? What I need is feeling fulfilled and in service to my community. And so then the decisions that I made regarding my choices, my job choices, has also changed over time. And that's okay. Like, I guess what I'm trying to do is remind you all that making a choice right now doesn't mean you're locked in forever, you know? And sometimes it's difficult to remember how powerful we are, you know, because we have circumstances, right? Oh, I can't leave this job because I need my paycheck, and I can't be creative because I need to follow this particular path. But that's not the case. I mean, I think I'm also coming from a privileged perspective in the sense that, you know, we don't always have the support that we need to make those big shifts. And that's completely understandable. But sometimes it's the small steps that get us there that make the big difference. So maybe you can't jump to the next job right away because that's not in your control, but you can submit, you know, you can update your resume, you can submit the application. And those are the things that are in your control that will get you a little bit closer to the next step. So again, just remembering, just because you've made a certain decision right now doesn't mean you're locked in forever. And again, look at the things that are in your control, because that's going to make you feel like you're moving in the right direction and that you're not stuck.
There is a lot of pressure. I think once you kind of, you know, land your first job, or maybe like a job that's steady for you, there can be a lot of pressure on you to sort of keep that same position and not think broadly or think about moving positions, because it just feels scary or foreign or unpredictable in some way. I think one thing that I've heard you say,
yeah,
it's really interesting to me, is this idea of the value of a network of people. So you gave the example of, you know, a colleague of yours in the public health department who mentioned that there was an opportunity to work with Dr. Ferrer, And that was sort of your entree into getting an interview there. So, I think you've got some really interesting insights on networking. Including this idea that, like you mentioned this before, that, networking, that we're doing some networking almost like every day, showing our work ethic, credibility, the way we work with our peers. And I think our students hear about networking all the time and the value of it. So I would love you to talk more about this importance of networking.
Oh yeah. I mean, I think the moral of the story here is never burn any bridges. You do not know who you're going to run into again. I went to a local school, now here working in Los Angeles, right? I've worked closely with my professors, and I've run into my peers on more than one occasion. Sometimes I've been the one that's interviewing them. There have been times where I've ended up being their supervisor. And honestly, like, anytime that you get to work in a group, for example, it's your opportunity to really just demonstrate your skill set, your dependability, your humility, how you're going to show up in times of stress. Like, these are all things right now you're thinking about it as a work project, as like a project for school. But it's not very different when you're working on these large scale projects as a public health professional. And people are going to remember that. Maya Angelou, I've been thinking about her this morning for some reason. And, she says that people remember how you make them feel, and like all of these things color how people feel about you, because that's how they're responding to how you're showing up in the world. So what I'm inviting you to do is just like be mindful about how you show up in the world, because people are paying attention, and public health feels like broad and vast, and it is, but it's also small, and it's also, just a beautiful, tight-knit community. And even though we all tend to be nice and caring and welcoming generally, your reputation precedes you, right? So you want to make sure that what people are sharing about you is positive. And it doesn't mean, I'm not saying don't be yourself. I'm not saying, try to be everything to everyone. No. I'm not saying that at all. What I'm saying is, be mindful about, not overcommitting and being able to deliver what you're saying you're going to deliver. Being communicative, if you're not able to pull through, like, share it as early as you can, so then you can do some troubleshooting. Doesn't mean that you have to be perfect. Like, perfection does not exist. We can continue to strive for excellence, but perfection is not real. So, I think no one's expecting that of you, but I think it is really important for us to be mindful about how we show up, because we don't know how we can be connected again in the future.
Oh, I can think of so many instances where people I've worked with 15 years ago, 20 years ago, come back into the picture again. And in some ways, it's really, it's exciting and rewarding, and then other times it's a little scary, because you're like, I was a different person 20 years ago. And so I really appreciate that. You kind of also started to hint at something which our previous speaker, Dr. Chang Desolkit, spoke about, which was, being sort of, present in your authentic self. I think you used maybe the word genuine to describe that. Maybe you could just talk to us a little bit more about why that's important, especially as you kind of move into leadership positions. I know it's a difficult topic, but those who are here for the first book event, you might recollect that Dr. Chang Desolkit told us about showing up to her first professional conference wearing heels for essentially the first time in her life. And she just found it so like uncomfortable and not her, that she felt like she couldn't really be herself professionally. And she found out that, if she went back to just wearing her sneakers and her Birkenstocks and talking about her young kids, and that she connected with people a lot better just by being that sort of genuine version of herself. Yeah. So I don't know, would you be willing to tell us a little bit more about what you think about this idea of being genuine?
Of course. I think, I can think back on both my education and in my earlier professional career, and remember that I was there's been moments where I've been either the only person of color or the only Latina in a room, you know, and that sometimes makes things difficult to then want to offer a different perspective during a discussion or a conversation, in part because I felt like I didn't want to expose my otherness to a certain extent. You know, it didn't feel comfortable for others to know more about me because my experience was different than theirs, you know. But as I've gotten older, I've realized that there really is no shame in coming from East Hollywood, right? An area that was really hard hit by the LA riots, or by having parents that are immigrants from Guatemala, or having to be bused, you know, to school, K through 12, 30 miles one way, you know, or having my daughter in my early 20s. Like, there's no shame in that. And actually, like, those are all the experiences that make me me, you know, and there's value in that. Especially as I do more equity related work. I mean, I realize that there's so much power in that experience because I can offer real life, you know, challenges, solutions. I'm not just looking at data, I'm looking at my family, you know, I'm looking at my community. And those are things that are meaningful and powerful, right? So there's no shame in that. There's actually strength in that. And I think that's part of, you know, I've had to embrace the fact that that's part of me, and that's part of being my authentic self, is being okay to a certain extent and bursting that bubble sometimes, that I'm not necessarily coming at things from the same lens as you are. It's not good or bad, it's just different, you know? And then, I mean, I think that's been one of the biggest realizations that I've had to work on to feel a little more comfortable. And I think, you know, as our leadership has also become more diverse, as we've welcomed in, you know, I mean, our department has grown. We've gone from maybe like 3,000 employees in the past, you know, I don't know, 10 years to closer to 7,000 with all the contractors that have come in to work on, you know, during COVID. But the organization has really changed. And that's just not, you know, to speak about the Department of Public Health, but I think generally, you know, we're looking at equity, diversity, equity, and inclusion in a more strategic way. And I think it's become more of a safe and inviting environment to be able to consider how that part of me makes me better at my job, you know, for the work that I'm doing, right? So I think feel that comfort in being my authentic self, like, has been incredibly useful. And then being able to step into my leadership potential, right? Because then I feel more confident in my ability to make decisions, to make investments, to reach out to others in a way that I didn't feel as confident in doing before, you know? So I think, you know, there's definitely power in feeling like you could be yourself, because then that just makes you better at your job. And I mean, and honestly, I think it's also important to recognize, right? These like social and cultural things that we bring with us are just some of the things that we bring with us. We bring our entire selves to work and to internships and to all these different settings, right? You can't just turn those things off. You know, I recall I had a former supervisor that told me that I was really great at exhibiting servant leadership. And honestly, my first reaction was kind of off-putting. Like I didn't like it. And I think my sensitivity to it is because, I mean, as a speechwriter, right, I love words, and I feel like there's power in words. So even though I didn't quite understand this concept of servant leadership, my first reaction was a little negative. But then on the flip side, I was kind of intrigued, thinking like, well, what does this even mean? And why is she using this terminology to describe me?
Yeah,
and I realized,
right there. Sorry,
yeah,
I don't mean to cut you off. Explain in what context did you hear this phrase, servant leadership?
Yeah, it was part of my performance evaluation. So she was giving me positive feedback. So even though I didn't like the term, I knew she meant it as something positive, right? So that's what intrigued me. I realized like, okay, I could have my reaction and that's mine, but I can also do more work to understand where the perspective she's coming from. But in doing so, then I also realized that there's some principles to servant leadership that are just part of my upbringing and are part of my culture, right? So this sense of putting others before myself, right? This community orientation is part of servant leadership, right? So is, finding, making sure that that I'm prioritizing people over the work, right? Like we come with other things happening in our lives, right? It doesn't mean that I'm not focused on getting results, but it also means acknowledging the fact that we might be putting up barriers for ourselves if we're challenged in different ways when we're solely focused on the end result and not how the person is doing when they're trying to get to the end result, and then just serving with humility. I mean, I think we have to understand that no one knows it all, including yourself. Right. So we're going to have to take a moment and be like, oh, okay, I, can continue learning. It doesn't matter if it's the person that's picking up my trash or, the head of the department. I'm going to treat them all in the same way because they're all offering me, kindness, help, support, and being able to do my job, so those are all things that honestly, like, as I'm mentioning, I didn't really like that term, but in further investigating a little bit more, I'm like, she's right. And some of these things come, as a practice. And some of these are also going back to authentic self, are part of how I was raised and the values that I have, based on my family, my neighborhood, etc. So I think all of those things then just again remind me of like how important it is to kind of acknowledge who you are, what values you bring to the work, and how you again show up when you're working with your colleagues and your supervisors. And yeah.
Thank you for explaining that. I just want to give folks that are here a heads up that we've got about 5 or 6 minutes till we're going to switch over to Q&A. But I've got one last thing I wanted to ask you about. You mentioned your community. And I know that you feel some sense of responsibility to your community. At least that's what you told me in sort of our pre-pool meeting here. I know you've got a passion for public health, but you seem to also be driven by like this sense of serving your community. And I'm kind of curious, like, is that an important part of leadership here? Is that something students should be giving some thought to about sort of what they should be giving back?
Of course. I mean, I think that's a key tenet of public health, right? Centering community and prevention. I mean, I think those are, it's important to keep that at the forefront of your mind because it gives you purpose. But I think remembering why you do the work gets you through some of the most challenging situations. The last 3 years have been the most difficult. I mean, I'm telling you, I've worked more than 20 years in public health. Most of that time here in the Department of Public Health, it has been some of the most challenging work ever, and at times even scary, I don't think I've been as scared or as, overwhelmed as, this pandemic has made me feel in the last few years. But I think remembering that, tangibly for me, when it comes to my day-to-day job, knowing that I had to translate, my talking points, and then I had to work with the Spanish-speaking media to let them know what we were learning about COVID, how to protect themselves, how to access resources. I mean, I think it was powerful, and it made, even though it was the most difficult work, it made it worth it. It made it worth it to me because I knew I was in service to my community. And it was worth it then when my parents, friends from church would say, I saw you on TV. You don't know how many times I'd get pictures of myself on the phone, from family members. Family members from Guatemala were sending me pictures of myself from like watching me on the news, and just thanking me for all the work. And I mean, it was funny because they thought I was fancy too. Like, wow, you're working with Barbara Ferrer, the lady with the white hair. You're working with that lady. Yes, I'm working with Dr. Ferrer. Like, they had no concept of what public health is, but it's definitely been an entree for me to be able to introduce public health, not just to my family and friends, but to other folks who might not know about public health otherwise. I mean, Dr. Wen talks about that too, right? About people not really understanding what public health is. Until something's missing, I mean, that's kind of been, it's true. So I think, being able to be of service in those tangible ways, leaving things a little bit better than I found them, and really just, again, being committed. I mean, when we talk about how are we going to move the needle on these, poor health outcomes, when we're comparing groups, we have to look upstream, right? We have to look at how investments are made. We have to look at how policies either increase access to services, for example, or make things more difficult. And I take my job as a civil servant very seriously. We've seen, and throughout history, right, government has played a huge role in whether or not we're facilitating access or creating barriers to things like wealth, and obviously health, right? And so I think it's such a privilege to be able to do work that leaves my home, LA County, a little bit better for my daughter and for, everybody else's kids and families, so it really is, important that you identify. For me, it's community, but I think for all of you to really identify, like, what are the things that, remind you that you're on the right track, and continue to pursue those things. It won't always be easy, but it's what's going to make it easier to continue doing the work, especially in the darkest of times.
That makes a lot of sense. I think, folks that stick in public health, they've often got sort of a North Star that guides them, something that they really care about and trying to change. And, folks who are in my policy class right now, that's what we did on day one, was try and figure out what policy they want to change, what's their guiding thing. And it can come from, it can come from your community and what their experience is. It can come from yourself, your own family. And I often give an example of a close friend of mine who's now a faculty in Michigan, whose brother died of a drug overdose. And so he's really committed to his, career, to studying drug addiction and substance abuse. And those things, I think, like in public health, we can latch onto them, like, I think, very strongly. And I suspect everybody that's, here today, and everybody that works in public health has something that kind of got them interested, some problem they were trying to fix, or something that they saw as like an injustice in the world.
Yeah.
They're trying to solve.
Well, and public health is everywhere. There isn't a facet of life that public health doesn't touch upon, right? And it continues changing and evolving. Our role does, as people have a different understanding of what public health is, we get invited to more tables, so whether that means climate change, whether that means gun control, I mean, these are like traditional things, but I think, they're also, it's also requiring us to kind of flex our muscles. And honestly, there might be issues that we haven't even thought of yet that, you could be tackling in the near future. So, I mean, we definitely won't ever have a lack of jobs in public health. I think there's definitely always going to be something to work on.
That's true. That is a good place for us to transition to questions from attendees here. So I just want to point out a couple of things. So first of all, Jackie, mid talk, I got a text from your colleague, Christina Vane Perez, and my former employee and now close friend. She just wanted to wish you good luck here. So she's saying hello via text message. And I also wanted to take a minute just to acknowledge that we have a new staff member in our department of public health, and I think she's on here as well, Eva Diaz, I believe. Did I have that right? So
yes, Eva Amaris Diaz.
Yes, okay, thank you. I haven't gotten a chance to meet you yet, but thank you for being here, and you're going to be an important part of our department going forward. So we're thrilled that you're participating in this too. So let's open up the floor for questions. I can try to read hands if people raise hands, but otherwise we can sort of take it as they come. Okay, I see Joed's hand up. Why don't you go ahead, Joed?
Hi, can you hear me?
Yeah.
Yes.
Thank you. It's so nice to meet you, Jackie. You've shared so much wisdom, and we're glad you're here. Many of us are seniors who are attending this event, and you've mentioned that you've had several career changes and job changes. And if you could go back in time and talk to yourself as a new grad, what advice would you tell yourself as you may have experienced fear about what comes after college and navigate those feelings of self-doubt?
Mhm. They say it's okay to be scared. Sometimes I think back, I mean, full transparency, I think mental health has been like something that we all really have been focusing on as a result of the pandemic, right? And the desire to feel comfortable and confident, all of these things. So again, in full transparency, in the past 2 years or so, I've really been working with a therapist to be able to think about like how I exist now, but also how that's been, it's a result of a multitude of things, my personal experience, my upbringing, all these things, right? And I realized how being afraid was something that I was really not allowed to do, as a child, right? And it's because that distracts from being able to get things done. And my parents, I love them. They're my heroes. They had to work all the time to be able to make ends meet for my family. So that meant I could not waste my time being scared because I had to help raise my siblings, And so I think acknowledging the fact that sometimes I am afraid and it's okay. It is okay to feel afraid. Now, the shift is, it's not just I'm gonna let my fear paralyze me. No, it's okay to acknowledge the feeling, but it's also okay to ask for help. Because I think sometimes the sense of overwhelm is what adds to the fear, right? But I think being able to say, I mean, today we met, so we met today. You can say, hey, I'm gonna email Jackie and see like does she have any tips for how do I apply for working in the county? I mean, that's just an example. But I think taking a moment to say like, I am afraid, period. What's within my control? Oh, I can ask for help. Oh, I know this person that can help me. Or, I mean, you have these wonderful professors here too, who have their own networks as well, that I'm sure, one, are just willing to listen, and two, can help point you in the right direction. So I think it's important, I think, to acknowledge the feeling and also see like, well, what's in my control? We talk about this again, I'm mentioning my therapist. I love her, but we talk about our triangle of control, right? Like, what are the feelings? What are the emotions? What are the behaviors that are in your control? Everybody has their own triangle, right? I can't impact your triangle, but I can mine, right? And so I have to figure out, well, what are the things that I can do within my triangle to be able to feel less afraid? So I think, I think those are the things that I would tell myself. It's okay to have an emotion, and then it's okay to ask for help, because none of us are doing this alone. And honestly, when we do that, when we kind of open ourselves up, when we're a little bit vulnerable, I think it makes other people feel important, because then they have something to share with you. And that means that, they also see that you think that they're of value, right? And it's not about them, it's about you. But I think what I'm saying is like, people are willing to be supportive of you when they're seeing that you're going out on a limb and you're asking for help because you're feeling some sort of way.
Great, thank you. Other questions?
Thanks for the heart, Morgan.
I have a question.
Go ahead, Brenda.
I feel like Joe had mentioned, like, a lot of us are seniors. How do you build like a solid network? I feel like sometimes it might be difficult for us, and there's like a lot of pressure, especially as we're graduating. So yeah, any tips on that?
Yeah. So we were just chatting about that earlier, actually. So I have an 18-year-old daughter, and she's just wrapping up her first year in college. She was telling me like, oh my God, Mom, it's so overwhelming, all of this. She was the type of kid that I would take her to new places and I'd have to prep her, like, okay, honey, today we're going to go to the dentist. You're going to meet new people. They're going to ask, what are they going to ask you? What do you think they're going to ask you? Oh, they're going to ask me my name. They're going to ask me my age, very silly example. But I think what I had to do with her is to help her feel a little more comfortable with the uncomfortable. I think people often think that I'm not shy because I talk a lot and, I can be social. But I'm actually, that's why I love my job, because I get to be behind the scenes, that's my preference, but then there are things that I have to do to feel a little more comfortable in that like discomfort, So what I've done with my daughter has been like, okay, well, let's think about a little like script that you can have for yourself. What are the top 3 things that you want people to know about you when you're meeting them? So for her, she's a performer, so she says, oh, okay, well, my name is Cielo and I consider myself an artivist. I use my art as activism, that's what she, that's what felt comfortable for her. Right? She has a couple of other things that she says, but I think those are the sorts of things I think that, help us navigate in these spaces where we might not know how to like just start up a conversation. Sometimes that feels like random, right? And honestly, it doesn't always feel comfortable for me either. But you realize like there are moments when just meeting that new person is going to make a difference, because then it's not just like a cold call, let me submit my application or whatever. There's like a personal touch, right? Oh, Jackie, we met on this blah, blah, blah. Let's. So I think those are the sorts of things I can offer you, is like have a sense of how you want to show up in these places and do some of the work that prepares you to feel more comfortable in that space. So whether that means, having that little script that's useful, again, it might be kind of a silly example, but when Cielo was younger and she had to go to her day camps, she didn't always know how to break the ice, right? So one of the things that we did was put a deck of cards in her backpack, because then that would allow her to say like, let's play a card game, instead of like, having to make small talk. Then they're talking about this card game. What's the equivalent for you? Does that mean like, oh, let's talk about this really cool book that Dr. Wen wrote? You know what I mean? Like have a few things that are of interest of you, to you, that then you could share in these spaces. So whether that means you're having a conversation with a colleague, at work, or if you're at a conference and, you're interacting with new people, those are things I think that at least make you feel a little more comfortable as you're, trying something new.
Let me just add on to that too, Brenda. You're building a network right now, like in this very meeting, just by being here and being present, and so people now know your name, and being part of the Public Health Student Association that's also hosting this, that's building your network. So network doesn't have to be people that you're not used to contacting necessarily. It's just the people that are around you all the time. I think that's an important point here. Other questions? I see Dr. Zelman, your hand's up.
Hi, I may have as much a comment as a question, but I'll
sure.
take that prerogative. Jackie, nice to see you. Great you could come. I wanted to tell the students that you see someone like Jackie Valenzuela and you say, wow, could I be like that? Well, not everybody can be this engaging and that warm and that articulate and that, all those things. But I wanted to suggest there are lots of ways to get ahead, lots of ways to make progress in life. I just wanted to throw out a few things. As I heard Jackie talking, I thought about a few words that really stuck in my mind. One was reputation. As you move ahead in your career, guard your reputation. It's the most important thing you've got. And everybody you know, everybody you meet is going to make some opinion of you. And it doesn't have to be flash, what you want them to walk away with, that's a thoughtful, good person. That person has ethics. I can rely on that person. They are disciplined. You don't have to be a flash. You can do it in a quiet way. And a lot of our students, I've always said, we have a lot of shy students, a lot of quiet students. That's okay too.
Yeah.
Bosses like quiet people. They like thoughtful people. They like people who are not out to show themselves all the time. And there are millions of jobs out there for thoughtful people who are a little afraid of the limelight. And maybe you can overcome it like Jackie, maybe you can't. That's okay. Just find your space. And if it's a quiet space, people will respect you for that. And I think I've always thought, and I'm not good at it myself, but the most important thing I think people like is a good listener.
Yeah.
And a good listener is really valuable. And it's valuable to be a good listener and show that you're a good listener. So those are just awesome things that I think in the long term kind of build your credibility, build your assets. And Jackie mentioned flexibility in jobs. And I think that's a good thing too. Don't be afraid to change. On the other hand, and I've learned this to some extent, have something in common when you change. Have some sense of who you are, what you want to be, and don't go like this, go like this. It can be a little varied, but have some goals in mind, because as you get older, changing will be more difficult, and you want your past experiences to build on you and build your reputation. So those are just some thoughts that Jackie, I'd be happy to hear any comments you might have about how to network, how to get ahead. You don't have to be a flash with everybody you meet. You can be quiet. People will get you and people will like you.
Oh yeah. I mean, I think it goes back to the conversation about authenticity. We need all kinds of people on a team, I tell Dr. Ferrer this all the time. Sometimes I'm sitting there like watching her, I'm like, why are you so smart? How are you so quick at formulating an opinion? And she says, oh, Jackie, she's like, I'm a lot older than you. I've worked in all kinds of different places, some of them way smaller than public health, that have required her to do more in the weeds work with a variety of things, just because their staffing capacity is smaller than ours, right? So, I think it's important to remember there's room for everyone on a team. It's important for you to also just acknowledge, like, what feels most comfortable to you. There's power in that as well. You don't have to make yourself something different or someone who you're not. I think there are some things where we might not have a choice, right? Like someone was mentioning, I think in the chat, that there might be moments where you have no choice but to do some public speaking, for example, right? It might not be what you do every single day, but there are moments where you might not be able to escape it. But what do you do to make yourself feel more comfortable? I think that the thing is don't wing it. Don't wing it. Do the work, the prep work that it takes to feel more prepared. Because I think when you feel comfortable and confident in a topic and whatever the task at hand is, then you're going to be more successful, because you're not thinking about, am I doing this right? Am I, so put in the work to prepare before you try something new like public speaking, because I think that'll go a long way to making you feel a little more comfortable as you're doing these new tasks. And then realizing that it's okay to fail, and maybe fail is a strong word, but I think it's okay to make mistakes. No one is perfect, I think I was watching something about a woman who started a company that was focused on girls who code, right? And she was talking about workshops that were being done with boys and girls, and how they asked the kids, they were maybe middle schoolers, to write code, a line of code. So they gave the kids a certain amount of time, and then the instructors went around the room to see what code the kids had written. They found that the boys were more likely to have a line of code, even if it was wrong. It was on, they had something on their screen, whereas the girls were less likely to have something on their screen. But when they were able to look at like the past strikes that were done on the keyboard, they noticed that the girls had done work. They just decided to delete it they didn't want to have something wrong on their screen. That was really like the ultimate reason why there was that difference. But I guess what I'm saying is, obviously that's not just an issue that girls face, right? I think our fear of getting something wrong shouldn't stop us from trying something new. I think it's important for us to say like, okay, I might make a mistake, but I'm going to give it a shot anyway. And then I'm going to learn from that. And I think if you have that, commitment to ongoing learning, then I think you'll be less afraid of making the wrong decision or doing the wrong thing.
There's another question in the chat for you, Jackie. What's the biggest challenge you faced in your public health career? And what did you do to overcome it? This is from Martha.
One of the biggest challenge. I don't know if it's the biggest, but one of them has been oftentimes thinking like, am I being a mouthpiece because I could speak Spanish, or am I actually delivering information that is trustworthy, credible, and I think it's important for you to take a moment. If something feels uncomfortable, to do a little thinking about it. Having a supervisor or working in a work environment doesn't mean that you can't ask questions, to be able to feel more settled. I think, in my upbringing, right, you don't question authority, as a kid, it was my parents, but, now it's also my supervisors. But, I've had wonderful mentors, including supervisors, right, that have created a space where I realized like, oh, I can be myself, meaning kind and respectful, and still be able to ask questions, about whether like that would help me feel more at ease with this strategy or whatever the case may be. So I think, again, just kind of feeling settled with being able to question authority, especially in kind of these large scale, activities. I mean, man, being able, I often find myself like, wow, if the department is counting on me to be able to share this message specifically with my community, because I'm the Spanish speaker that they're relying on at this point, I'm like, what am I going to do to make sure that I feel comfortable with the information and that I deliver it in a way that feels, credible, because, I was lucky and spoke Spanish at home, but my different jobs have required me to speak Spanish. And so only over time has my Spanish improved. And only over time have I been able to learn the specialized language that public health requires as well, because it's not just about speaking Spanish, right? It's also about knowing the terminology and then realizing that terminology is also going to change based on what the issue is at hand, right? So whether I'm talking about lead in soil or radiation in, the air that we breathe, or, COVID virus particles in, a classroom, making sure that I know how to do that, requires just taking a step back, making sure I get help if I need it. And then also, again, just making sure that I know what's going to make me feel at ease so then I could be of most service.
Let's see if there are other questions. Judith, go ahead.
Yes, hi, Jackie. It's a pleasure to have you here. Thank you for sharing your experience. I had a question, and I know you mentioned that you had a kid in your 20s.
Yeah.
So my question was just to know, how did you manage the time to take advantage of all the opportunities that were presented to you to network while having a child? Because I am a senior and I also have a daughter, and sometimes I feel like I'm missing out because I'm not able to take advantage of all the internships that are in school, just because I don't really have help and I have to go back home and take care of my daughter. So I just wanted to see how you went about that.
Oh yeah, I completely understand. I mean, and I think I also have to just acknowledge I did have a lot of help from my parents, I had her in my early 20s, and she's really just been the driving force actually for a lot of this work. I've had tunnel vision because it's really been, how do I make sure that she has what she needs plus a little bit more. She's actually the reason in part of why I'm here, actually. When I was an undergrad, you have to complete not an undergrad, excuse me, I was wrapping up my MPH. So you had to complete, internship hours. So I was looking for an internship where I would get paid because I couldn't not get paid, so that took some time. And I had interviewed actually for an internship with the county. The county is notorious for writing things in such a squishy way that sometimes it's not clear whether or not it's a paid internship or not. So I went to that interview not really knowing whether or not it was a paid internship or not. So I went and, I actually got an offer, but I couldn't take that internship because it didn't pay. Fast forward maybe, I don't know, 6 months later, and I get a call from the folks that I interviewed with, saying that they had a job opportunity and that they would love to interview me. And, so it was really odd how things just kind of worked out that way. I don't know that I would have picked working for the government or local government if it didn't just kind of happen in that way. And my daughter really motivated me because public health, I don't know that we talk about this enough, right? But a lot of it is grant funded, right? Like you kind of have to hustle to jump from project to project based on where, you're working. I knew that I was going to be raising her on my own and that I needed to, have stability. So I think then, Judith, part of it was making sure that I always kind of kept in mind like what I needed and pursued opportunities in a more strategic way. You're right. Maybe we don't have that flexibility to just take on everything under the sun. But I think it could also be helpful, right? In the fact that you then become more selective in the opportunities that you pursue. I mentioned nursing school. At that point, I was already a director of a program, and I went to a nursing program that allowed me to do my nursing classes in the evenings. And then I had my nursing practicum, on weekends. So my daughter was around 8 years old at the time, and I barely saw her. There was a moment where she told me, Mom, like, I just need more time. And I mentioned earlier to you how it felt backwards, right? Being in nursing felt backwards to me because I really wanted to focus on public health and that orientation. But then hearing that from my daughter also just kind of sealed the deal for me in the sense of like, I could let that go. It was hard initially because I was so focused on accomplishing that goal. But I think, again, just continuing to think about her and what she needed and what I also wanted, I think it just made it more difficult. So I knew it was clear ultimately what decision I had to make. Now, as far as I think it's important, this conversation that we've been having about how your network is there's always an opportunity to network, right? So I think don't lose hope. Just because you're not going to all of the events, for example, doesn't mean that you're not networking. Just continue to show up, continue to be able to demonstrate your skill set, your capacity, because the work speaks for itself. And again, people are going to remember that. So don't fret if you're doing all kinds of, you can't do all these things, because wherever you are at, maximize those moments. Because those are just as meaningful and impactful. And I promise you, centering, you do the things that you do in part, I would think, in service to your child as well. Continue to make that the motivation, because then that'll help you navigate as you move through your career. And I think, I don't know how many folks here have kids, but I think it's also important for us to remember that we are also individual humans aside from our parental role, right? So I think it's also important for us to find time, and it might be difficult, but to do things that we're personally passionate about. So whether that means these spaces where you get to meet other friends or whatever, again, you don't necessarily have to do everything, but pick a thing or two that is going to be meaningful to you, not just for your professional path, but also to feed your own like soul, because then that'll make things easier, and things like networking then will become a little bit easier as well.
Thank you.
Mhm.
Great. I think this is a time for us. We could probably take one more question, but maybe before we do that, we have a tradition of taking a group photo together. And I'm hoping all of our attendees would be willing to turn on your cameras. And I'm going to try and unpin us here if I've got this right. I'm gone. There we go. Let's see. Yeah, let's see how many videos, squares we can fill up. And if you've got your book with you, we'll take a picture in just 30 seconds here. Let me get it ready. All right, folks, let's see if we can get a few more videos on so we can see smiling faces. It's just for a minute. No judgment on backgrounds, outfits, pets, kids, any of that stuff. It's all good. There we go. See, even in the car is A-okay. It's all right. Give folks 10 more seconds. Yes, excellent, Luz. Thank you. Anybody else? Last chance. Okay, all right. So hold up the book. We'll take a couple of pictures. Smile, everyone. Okay, actually, I think that'll do it. That one turned out really good. All right. Now everybody goes back to hiding, right? Turn off those cameras. I get it. All right. Are there any last questions? I think we could probably take one more with a short answer, that we can hand it back over to PHSA. So one last question from anyone?
I had a comment more.
Sure.
I really appreciated your presentation today, Jackie. It was very inspirational for me as well. Like being a Latina myself, having a drive to work. I want to work in communities, so having that drive reminding me of doing that is very inspirational, basically. Thank you, and I appreciate you coming in today too.
Thank you so much for saying that. And I think it's important for us to remember, honestly, sometimes I forget that other people could see me in that way, and I think so it's important for us to see, we see people like that above us, but also our peers, and so do folks that it's just important for us to see ourselves that way too, so thank you for sharing that with me. And I think it makes my work a little more doable as well. And I promise you, we won't have the same journey. Your journey will be special and unique in its own way, but it's going to be meaningful, and it's going to be important. So thanks so much for that. I see Carolyn. Thank you so much, Carolyn. It's been a while since we've seen each other. So thank you so much for the nice note. Oh, you're on mute.
Yeah. You're welcome. It's good to see you. Thanks for joining us.
Thank you.
Jackie,
we wish you'd be for us again.
Yeah.
We do want to recruit you back,
Take care.
Yeah. Jackie, thank you so much for your time today. It's been such a pleasure having you here. We're very honored that you joined us. And I'm so happy to see so many people who came to this event today. Once again, it's a nice mix of our undergraduate students, our graduate students, and our faculty and staff. So I'm thrilled about that.